Welcome to Bovie Medical Corporation's training module. In this module, we will learn about the A940 40-watt high-frequency desiccator. The A940 is a ground reference unit used by doctors and veterinarians for simple skin procedures or in areas that require light coagulation. It offers 40 watts of monopolar and bipolar coagulation and does not require a grounding pad, which is a cost savings to your doctor. When the A940 is delivered, it is ready to use. The unit comes with an A901 autoclavable power control handpiece, 100 non-sterile dermal tips, 50 sharp and 50 blunt, a hospital-grade power cord, wall mount kit, and user's guide. Most of the procedures performed with the A940 high-frequency desiccator are done using 1 to 10 watts. Bovie has engineered the A940 to adjust in 1/10 watt increments in the first 10 watts and monopolar and bipolar, giving the user the most accurate energy delivery available. The A940 allows the doctor to go from low power to high power in one step, not 4. Simply turn the rotary dial on the unit or use the up-down buttons on the autoclavable handpiece. It's that easy. Let's take a moment to introduce our competitor, the ConMed Hyfricator. The Hyfricator, or high-frequency desiccator, is a 35-watt unit. To change power from low to high on the ConMed unit requires 4 time-consuming steps. Step 1. Unplug the handpiece from the low power receptacle. Step 2. Move the power selector switch from low to high. Step 3. Plug the handpiece into the high power receptacle. Step 4. Adjust the rotary dial or up-down buttons on the handpiece to the proper power setting. If the doctor wants to return to low power, it's 4 more steps. The A940's one-step power control is an obvious advantage. When your doctor requires foot switch activation, the A940 makes it easy. Simply plug in the optional A940 foot switch and activate. There's no expensive separate handpiece, and the handpiece retains the ability to adjust the power and activate the unit in this mode. Using the ConMed Hyfricator, if your customer wants to utilize the foot control option, it requires 6 time-consuming steps. Step 1. Unplug the 3-button handpiece from the bottom of the unit. Step 2. Unplug the 3-button handpiece from the front of the unit. Step 3. Remove the handpiece from its holder on the unit. Step 4. Attach the separate foot control handpiece. Let's pause here for a moment and reiterate Step 4. Attach the separate foot control handpiece. This means the doctor must purchase an additional handpiece in order to use the foot control feature, which means an additional cost to your customer. Okay, where were we? Step 5. Plug the foot control handpiece into the front of the generator. Step 6. Plug the foot switch into the bottom of the unit. On the A940, the doctor just plugs in the A940 foot switch and activates. It is practically effortless. Before we move into the A940 opportunities, let's discuss safety. Bovie engineered the A940 with the patient's safety in mind. Bovie DED, or Digital Error Detection, monitors all functions of the unit to ensure proper output. At the sign of any problem, the machine instantly disables and the appropriate error code is displayed. There are many opportunities for the A940. Every dermatologist office should have an A940. End of story. Any plastic surgeon, urologist, ophthalmologist, veterinarian, or physician office who is performing procedures requiring light coagulation is an excellent candidate for the A940. The previous slides discussed the ConMed Hyfricator, the competitor, versus the A940. To briefly review, the Hyfricator is a 35-watt high-frequency desiccator. The A940 is a 40-watt high-frequency desiccator. The ConMed Hyfricator requires 4 steps to change from low to high. The A940 requires 1. The ConMed Hyfricator requires 6 steps to use foot switch activation. The A940 requires 1. The ConMed Hyfricator requires a special foot control handpiece. The A940 does not. The A940 offers you more power, 40 watts. It is more user-friendly, requiring less steps and less additional accessories. More features with less hassle. The A940 is the more logical choice. For more information, contact sales@boviemed.com or call 1-800-537-2790. Thank you. Good luck and good selling.